Dr. Fiona, welcome and thank you very much for your time, for having me in your clinic, first of all, to talk about one of the main topics, hot topics in this world for ladies, menopause and perimenopause. Welcome, first of all.
Thank you. It's a pleasure.
Doctor, it's one of the most unknown topics that could cause so many issues, which we would like to dive in one by one. I've prepared many questions. So let's start, first of all, about menopause. Could you give us like a brief about?
Okay, so menopause is when a woman has not had a period for a year. It's the end of the menstrual cycle and the beginning of the next phase of her life. Menopause is preceded by perimenopause, and that can last for up to 10 years before menopause.
Okay.
So menopause usually happens around the age of 51, 52. So women in their 40s are usually perimenopausal. And unfortunately, perimenopause goes unrecognised by women and a lot of doctors as well. A lot of these women will still be having their monthly cycle. It might have changed a bit, but it might be completely normal. So they won't recognise a lot of the symptoms as being hormonal. So what happens is when you start to go into perimenopause, what's happening is that when you release an egg every month from your ovary, it's not as good quality as it was when you were younger. So because the egg isn't good quality, you don't mount a good hormone response. So instead of having nice stable levels of the two main hormones that the ovary produces, estrogen and progesterone, levels start to fluctuate, and that causes symptoms because every cell in the body needs estrogen and testosterone and to a certain extent progesterone to function normally. So estrogen and testosterone, which is also produced by the ovary and is not just a male hormone, every cell in the body has receptors and need these hormones to function normally. So estrogen and testosterone work neurotransmitters in the brain. So if the brain isn't getting enough estrogen, one of the first things that happens is sleep gets disturbed. So women will say they get off to sleep okay, they sleep deeply for a few hours, and then they start waking. Can't get back to sleep, and then they'll doze off and they'll wake again, and so their sleep quality declines. Mood changes happen. So irritability is a common one. People say they feel like they've got premenstrual symptoms all month. Anger, feeling emotional. Some women develop anxiety and low mood, and this is often incorrectly diagnosed as depression, and women are put on antidepressants incorrectly.
Sorry, doctor, to interrupt you, but we're talking right now about perimenopause, right?
Perimenopause
Yes.
and menopause have
And
the
menopause.
same symptoms.
Okay.
It's just that in menopause, women are often more aware because they know that hormonal changes are happening. But in perimenopause, they don't always realise, because their cycle might be completely normal, they don't realise that a lot of these symptoms are hormonal, and it's because the estrogen level is going up and down instead of being stable. And often memory is affected, concentration. And one of the other things that I'm all the time is people feel overwhelmed by situations they would normally cope with very well. So they can be sensitive, irritable, overreact to situations. So that's all brain effects. And then muscles, joints, tendons, ligaments, everywhere needs estrogen. So people will say they get achy, takes long to recover from workouts, old injuries flare up, dry skin, dry hair falling out. Some women get flushes and night sweats, but that often will happen later on when estrogen levels really drop after menopause. Libido is affected, so really every cell in the body. So that's perimenopause. And as I said, that can go for 10 to 12 years, usually between 40 and 50. And often women will say to me they've been to their doctor, they've had blood tests, and the doctor says they're fine, there's nothing wrong with them. But you cannot diagnose perimenopause on a blood test.
Okay.
Because the hormone levels change every day, you might get a high level, you might get a low level. It's irrelevant. We talk about symptoms.
Yeah.
So that's the basis of perimenopause and menopause. And then once you do go into menopause, then your ovaries have failed and they no longer produce those hormones. So then there's a whole another aspect to that, because the longer you're without estrogen, the higher your risk of diseases of aging. So osteoporosis, heart disease, there's now a lot of evidence to suggest that dementia is accelerated in women without estrogen, colon cancer and diabetes. So they're the 5 diseases that we know estrogen has some effect on. So 150 years ago, women went through menopause later at around 57, and the average life expectancy was 59. So there was only one phase to a woman's life: childbearing, menopause, and then death. Now, women can be 30 to 40 years in full menopause with no hormones. So there's 2 parts to it. One is symptoms, and the other is prevention of diseases of aging. And everyone has their own journey. Some women breeze through perimenopause, breeze through menopause, no symptoms, menstrual cycle stops, and they're fine. Other women have a terrible time. So it just depends on a lot of what's going on in their life, stress, lifestyle, diet, exercise. So as I say, everyone has their own journey.
Yeah. So you mentioned about sleep. Is it like some women probably have some issues with high dosage of caffeine at night or stress levels? How can they defer that lack of sleep or the disturbance of their deep sleep, whether it's due to the perimenopause or something else?
Okay, so often sleep is related to high cortisol levels, and high cortisol levels occur with stress. And most people have very stressful lives, especially here in Dubai. It's also related to adenosine and sleepiness. So you've got to develop a level of sleepiness over the day. And if you are consuming caffeine competes with the adenosine receptors in the brain, so it knocks away the adenosine, which is the sleepiness. Yeah. So important things with sleep are not to have daytime naps, because that will just take the edge off your sleep and then you won't get to sleep at night. Not having caffeine after around lunchtime. Reducing levels of sugar. Sugar can aggravate sleep enormously. Eating clean. So having a good diet free of processed foods and sugar helps everything. Helps hormones, it helps sleep, helps well-being, helps mood. So that's a whole nother podcast, diet.
Yes, totally, yeah.
So diet, caffeine drinks, daytime naps, and then the other thing is exercise. Exercise, hormones, improves mood, sense of well-being, and it makes you tired and helps you sleep. And not exercising in the evening, because then you're going to get high levels of adrenaline and all the other stimulant hormones. I suggest every woman takes magnesium at night, magnesium glycinate or magnesium threonate, because those two are specific for sleep. Sometimes I add an ashwagandha, which is an Indian herb, and taking that before bed will often help the quality of sleep.
Quality of sleep, which is very important.
And the other thing with sleep is going to bed at the same time every night and getting up at the same time every morning. And then your brain is used to sleeping between those hours, because if you're changing that and having late nights and sleeping in, then the next night your brain doesn't know what it's doing. And the other thing that really affects sleep enormously, especially as you go into the sort of second phase of your life in menopause and perimenopause, is alcohol.
Yeah. How does that affect?
So alcohol will often get you off to sleep, but then you wake and it affects your quality of sleep and it affects your recovery.
Can we say in simple words that the sleep and the quality of sleep, you mentioned how to get that quality of sleep, helps in regulating the hormones, which helps prevent reaching to the menopause as early as possible and prevent the perimenopause as well?
That's sort of hard to tease out really, but if you have a good sleep and you'll wake up feeling refreshed, then you're just more able to cope with situations that might occur through the day. You're less stressed, your cortisol levels are down, and all of the hormones made in the adrenal gland, the cortisol, the adrenaline, hormones made in the ovary, the hormones made in the thyroid, they all interact and interconnect. Yeah. The other thing that's really important is keeping vitamin D levels up, because as the majority of people here have vitamin D deficiency, and that can cause extreme fatigue and bone aches, and vitamin D is a hormone, so it's really important to keep those levels up. So I think for sleep it's really body rejuvenating, and you've got a hormone problem on top of that, then it just compounds.
One of the questions that women probably would ask, and before coming to this podcast I made my own surrounding survey with the women that I know training and my wife and other women, they all asked one question, is like how to prevent by fixing something before reaching to that early stage perimenopause, or try to push it as far away as possible, or have it within the normal timing for it. Because some women phase early menopause, like way much earlier, in their early 40s, sometimes even earlier, I don't know.
So menopause is normally set by your genes, and you often do the same as what your mother did. So some families have early menopause and some have later menopause. And so menopause can happen anywhere from 25 to 60. It peaks at, as I said, the average is around 52. You can't prevent it, but you can make it more pleasant. And that's lifestyle. Just talk till I'm blue in the face about diet and exercise.
Yes.
I just can't stress it enough. And it's strength and conditioning. As you age, your muscle, you lose muscle, replaced by fat, and you have to build muscle. You have to lift heavy weights. You have to be exercising your heart. You have to mix up the exercise. Strength and conditioning, sometimes some Pilates, some cardio, some yoga. So you've got to do something every day, because that is the number one thing that improves symptoms in menopause, reduces your risk of diabetes, improves your bone health. So that's number one. And I often have to say to women, get a trainer, because they will take you out of your comfort zone. No one really loves exercise, but you love the feeling afterwards, and the benefits are enormous. Diet, I've already mentioned that sugar to go. Healthy diet, eating enough protein. So what we see, one of the biggest complaints that I hear from women is weight gain. gain. Because as you go into perimenopause, your body is trying to stabilize the estrogen levels, and the way it does that is to lay down fat around the belly, the thighs, the hips, because fat makes estrogen. It's not a good form of estrogen. It's quite an inflammatory form of estrogen. It doesn't work very well. It lays down more. That's number one. Number two is that you get some form of insulin resistance. So when you eat carbs, they get converted to glucose, and the insulin's not working to take them into the cells, and it gets laid down as fat. So protein diet, low carb.
Some women, when you tell them eat extra protein, they will think that they're going to be bodybuilders, like men who go use the protein. And the protein that you're definitely talking about is not the protein powder, it's the protein that's within the food, like fish, meat, chicken, eggs, and
Correct.
all these proteins.
And I struggle the most
Yes.
trying to help women who are vegan or vegetarian. Because they are carb heavy. Any form of protein in a vegan diet is mostly from tofu, a high percentage of carbs as well. So all your beans and lentils, legumes. So I struggle with that a bit, trying to help women on a vegan diet.
So do you have like patients who come to you who are vegan and vegetarian having different symptoms of perimenopause or?
Well, no, it's really weight gain.
Weight gain.
Yeah. So no, I'm not against vegan or vegetarian diets. I just struggle to help women with weight loss when they're vegan because it's hard to give them pure protein.
Yeah.
And so do end up having a lot of more carbohydrates.
There are many ladies that I know who are on vegan for many years. And as much as I'm against vegan and vegetarian diets, but looking at their body composition and looking at their strength, I sometimes suspect that they are vegan. And when you talk to them and I've had an interview with two ladies in the gym, both are trainers. Their body composition is unbelievable. You can never believe that they don't eat at all any kind of protein except from the plant-based. And one of them is even raw vegan, which is like to the extreme level of vegan. But this is something that...
But I know why that will be, because they are doing it properly.
Yes.
And a lot of people will become vegan and not do it properly.
Yes.
They'll be eating, vegan bars or just carbs and not doing. If you do it properly, it's great, but it's intensive. It's hard to be vegan properly.
Yes.
In my opinion. That's just my opinion.
Let's stay there then about it. Doctor, now we knew the symptoms, or let's talk about the symptoms more in depth and how it's possibly treated. How can women treat themselves apart from lifestyle? Is there any sorts of medication?
Yeah, so lifestyle, and then we talk about supplements. So I mentioned magnesium, I mentioned vitamin D, and there's some great combinations of herbs and vitamins that are really good to transition into menopause. So often I see women who are having a few symptoms but are coping with them, and their quality of life is not excessively impaired. So they're not really ready for hormone therapy, so I'll often transition them with supplements.
Okay.
And then the second part, when they feel that their quality of life is impaired, then we'll talk about hormone therapy. Hormone therapy has come a long way over the years. So initially, we started off with synthetic hormones, synthetic estrogen and progesterone. And that's still around and it's still used by a lot of doctors. I tend not to prescribe that. It's usually taken orally. When you take estrogen orally, there are some risks associated with it, and there's some conditions that you wouldn't give oral hormones to. So what I prescribe is body identical hormones. So these are made from yam, the sweet potato, because yam chemically and molecularly is identical to the body's hormones. And these products can be absolutely life-changing for some people. And so in perimenopause, we give it to stabilize the estrogen, and in menopause, we give it to supplement the estrogen, boost the estrogen levels. They will take away hot flushes almost instantly, and mood, that sense of feeling overwhelmed goes. We'll just feel calmer and better, and often women will say to me they feel themselves again. So the estrogen we use is pure estradiol, which is what the ovary makes, plant-based, made from yam, and it's applied to the skin. So it's what we call transdermal. When you put estrogen on the skin, it goes straight into the bloodstream. When you take it orally, it goes through the liver and it can increase the clotting factors, which make the blood clot. So your risk of blood clots are higher. So we don't get that with transdermal. So we use an estrogen gel. For women that have had a hysterectomy and don't have a uterus, they just need estrogen. Women that still have a womb, their uterus, they need progesterone as well, and we use a yam-based progesterone capsule. And they take that at night. It's very calming, it's a bit sedating, it helps with sleep, and it balances the estrogen and progesterone. And then for some women, when I always do blood tests when I start people on these products. After a few months, if they're not feeling a lot better, we might add in some testosterone if their testosterone levels are low. And the testosterone we use is also made from yam, and it's a gel that they apply to their skin.
Okay. Some women will be afraid once they hear the word testosterone, and knowing that it's a more of a male hormone, but it's still produced by the woman. What are the risks of having testosterone for a woman? They develop masculine features and voice change or beard. Yes,
No.
like all the features that we know about testosterone.
No, so we give a tenth of the dose we give a man. So if we supplement male testosterone, we'll do 50 milligrams a day, and if we give women, we'll give 5. So we keep women in the female range. So we know what the female range is, and we give just enough to keep them in that range. So no, they don't develop any of those side effects that you've mentioned. Occasionally, women will go out of range. They might just absorb too much, and then we'll just pull back on the dose. So mostly no, there's very few side effects. There's side effects with everything. There's side effects with HRT, there's side effects sometimes with, so it's just, we just weigh up,
But you keep them in the safe zone.
Yeah, absolutely. And we do blood tests 3 months after starting just to make sure people are in range. What people feel with testosterone is a sense of well-being. They will feel less fatigued, have more energy, more motivation, helps memory, helps mood, sleep, and it helps libido. So I only give it to people whose levels are low and whose symptoms haven't resolved completely on estrogen. Some people are fine just on estrogen and progesterone. Some people need to add in testosterone.
So your first go with the hormonal replacement therapy is estrogen.
Mm-hmm.
And
because that's the primary problem, is estrogen.
Okay, yeah.
It's mostly all driven by estrogen.
Okay, excellent. Another question is the libido and the sex drive after the menopause. Some women were concerned, some men also are concerned about that. So does that change anything?
That's complex. There's a lot of factors involved in that. There's a lot of, if there's a relationship issue, libido is going to go. We often get vaginal dryness that can be intimacy painful, and so we often need to treat that. I talk to people a lot about libido and say it's never going to be the same as it was in your 20s and 30s, but we can get it to a point where you can usually get it to a point where it's pleasurable. So it's multifactorial, and some people, I say quite frankly, I can fix your hormones, but I can't fix your relationship.
Yeah.
So it's not just as simple as, this is hormonal.
But is it something related to menopause if we leave the relationship? So
definitely. Yeah. Women are designed to have their highest libido when they ovulate, and when they're not ovulating, libido goes.
Yeah.
Not everyone's, but... Yeah.
So it is affected by menopause. Yeah.
Definitely. And estrogen can help it enormously. Sometimes we add in testosterone to help it as well. Now, the whole testosterone, I just want a bit of a caveat. It's quite controversial at the moment because there's a lot of chat on social media. There's a group in the UK that is saying testosterone doesn't do any of these things we claim it to do. It may help libido, and the British Menopause Society recommend it only for libido. There's a group of us that are challenging this because I see women come back in time after time to say they feel so much better on testosterone. So just, people who are listening to this may have been reading stuff about testosterone on social media, and I disagree with a lot of it. I think if it's used carefully, it's a really good product.
Let's start with people who are, from your point of view as a doctor, would be not a good candidate for HRT, and what are the side effects, the symptoms that they might develop after HRT?
Okay, so when I prescribe HRT, it's usually a long conversation about changing lifestyle, getting the sleep right, all the other stresses in life. And then, as I said before, it's about quality of life, and then we get, if they're really struggling, then we'll do HRT. And I say to people, there are some side effects of HRT, but it's always risk versus benefit. So initially, some people may get a bit of bloating, sometimes the progesterone can cause headaches, some people don't get on well with progesterone. We can change the way it's taken, we can change the dose, and we can usually get people feeling pretty good on HRT. There's a few people that just can't get on with it and don't continue. And then there's a lot of women who will say, I'm not going to take HRT because it causes breast cancer. Okay. Now, that is not correct. So just go back one step. I would never give it to anyone that had active breast cancer. And actually, that is the only contraindication. There are no other disease processes that we can't give HRT. So I'll get a lot of women coming to me saying, I've had a blood clot, my doctor has said I can't have HRT. But that's not correct. If you use it on the skin, you can have it. Right, so that's just contraindications. Then the breast cancer issue. So in 2002, a study came out of the US called the Women's Health Initiative Study, and it said to the world that HRT causes heart disease and HRT causes breast cancer. Now, I was prescribing HRT HRT quite happily in the 90s, knowing that it reduced the risk of heart disease. And if you look at that logically, men have heart attacks 10 years before women, and that we know that is because estrogen is protective. When we know that if you're on estrogen therapy, your risk of cardiovascular disease is 50%, is cut by 50% if you start it within 10 years of menopause. So I just thought this is bizarre. Long story short, that study has been disproven. And there's been a lot of papers written, articles written, podcasts, talks done on the study. The study group were women over the age of 60 using high-dose synthetic estrogen and progesterone. Some of these women already had breast cancer, they already had heart disease. So that study's been disproven, but unfortunately there are still a lot of medical professionals and a lot of women that haven't moved on from that. So does HRT cause breast cancer? If you took 1,000 women between the ages of 50 and 59 and followed them for 5 years, after 5 years, 23 of that 1,000 would have breast cancer because that is a normal background risk. There is a 1 in 7 lifetime risk, and that increases with age. If you add an HRT, instead of 23 out of 1,000, it might be 27 out of 1,000, so 4 extra cases. These studies are done on synthetic HRT, so we're still waiting for some really good data to come out on the body identical, but we know that's going to be less of a risk. So the risk is small. Women not on HRT, if a woman was drinking a large glass of wine every night, so 2 units, their risk of breast cancer is higher than someone on HRT. Women who have a BMI, a body mass index over 30, their risk of breast cancer is doubled. So instead of being 23 out of 1,000 over 5 years, it's 46 out of 1,000. So lifestyle plays a massive part. Women that exercise, moderate exercise 2.5 hours a week, their risk is reduced by 7. So instead of 23 cases, it's 15 cases. So breast cancer, in my opinion, is aging and lifestyle. And if you keep yourself healthy, HRT does not play a big part in breast cancer. We also screen women every year with mammography and ultrasound. And we know that women on HRT that do develop breast cancer, which may or may not be related to the HRT, they do a lot better than women not on HRT. So the mortality rate is reduced in women on HRT. So it's a discussion I have with people. There's risks of everything. There's benefits of everything. Yeah. You know, you get in the car every day, that's probably a higher risk than taking HRT. But look at history and we make that decision together.
Amazing. Yeah. One last question, which was not on the list. I had an interview with one lady that I met on social media online. She's on the Carnivore diet for the last 3 years. During the discussion, we did not touch base about anything. I mean, it wasn't planned to talk about the menstrual cycle, but when I knew that I'm going to meet you, I had this question pop up in my mind. So I asked her. She's like, when I started the Carnivore diet, which is almost zero carbs, she said that she felt very comfortable with her pain and cramping, and it's normal. Have you heard of anything about that?
It's the power of diet. I mean, it's incredible. And, you know, so many studies now on the gut microbiome driving everything in the body. Yes. And keeping the gut healthy. And the way to keep the gut healthy is to be reducing carbs, reducing sugar, having fermented foods, your sauerkraut, your kimchi, your probiotics, natural yogurts, your Greek yogurts. So, yeah, I'm not surprised. I mean, I'm not a fan of specific diets because I think they're often hard to maintain. So, you know, I hear a lot of saying they feel so much better when they do keto, and that's fine. It's so hard to maintain long term, and I'm not sure that it's healthy to do it long term. I think a modification. Sure. So I say to people, reduce your refined carbs, cut out sugar, and introduce more complex carbs, because I think it's important to have protein. When you have protein, you have carbs. When you have carbs, you have protein. So with every snack, it should be a mixture, but it should be complex carbs.
Thank you very much, Doctor. This was very informative, and I hope all the women out there will benefit from this podcast to improve their lifestyle, to improve their health, mindset, and move forward with life and take this to the new generation as well.
You're very welcome. And if they want any more information, I do have some information on my Instagram.
Definitely. I'll link your Instagram as well and all your details, and they can reach out to you also if needed for more info. Thanks a lot, Doctor. I'm really happy. Thank you.